Okay, so in order to concentrically contract these muscles, with the sternocleidomastoid, the patient may rotate the head to the left or right, aka performing head turns. And then with the traps, the patient may perform a shoulder shrug with or without weights, so holding a kettlebell or dumbbells, or just with the force of gravity. And then with the anterior scalene, they could concentrically contract this with lateral flexion, and also you can do cervical flexion. So if they're just bringing their head and neck into flexion, example would be like 2 sets of 20. And then the middle scalene, they can provide resistance with, say, your right hand on the right side of your head and attempt to turn to the right while maintaining resistance with your right hand. That would be working the anterior scalene. And then the posterior scalene, that would be the same as the above two. With the transverse abdominis, this would be, to concentrically contract this muscle, it would be like abdominal bracing. So if you do posterior pelvic tilts while lying supine, you can describe this exercise as bringing your belly button to your spine or imagining that you are about to get punched in the gut. Then with your internal oblique, so to contract this muscle, the patient can be lying on their side and performing a side crunch while laterally flexing and rotating to the same side, and rotate and bilaterally flex the vertebral column. For the external oblique, in order to concentrically contract, the patient can do a crunch while reaching out to the right. So if they're lying on their back and they have their knees bent or flexed, they would perform a crunch and then also be turning to the right, and this would be working the left side of the external obliques. Then with the rectus abdominis, the patient may perform a crunch. So just lying supine and coming up and performing a crunch that will concentrically contract this muscle. Then the spinalis. So with this muscle, the patient can perform an intervention called bird dogs. So that would be when the patient is on their hands and knees, and they reach out their right arm and then extend their left lower extremity. So they want to maintain a neutral spine. You don't want your pelvis to like rotate to the left or right. You just want it to be a neutral spine, and this is going to work your spinalis. Then the longismus, the patient can perform prone lumbar extension, or thoracic extension. So when they are laying on their stomach and they're just extending up, almost like an exercise known as Superman's. Then with the multifidi, the patient can perform donkey kicks while keeping the leg that is being extended parallel to the pelvis. So it's almost like a bird dog intervention, but you're just not incorporating the upper extremity movement. And then with the rotators, the patient can again perform the bird dog intervention. And then for the quadratus lumborum, the patient can do a side plank in order to concentrically contract this muscle, while also in the side plank, if they were to raise their left arm, so they're on their right side, they raise their left arm and left leg almost as in a star position, this would be concentrically contracting that muscle. And then for the rhomboids, the patient can be lying prone on the table and have a dumbbell or kettlebell or just gravity and do a row. So pulling back like this, keeping the elbow flexed, just like this. And then lastly, the lat dorsi. In order to concentrically contract this muscle, they could perform lat pull downs on the cable cord machine.